My name is Tanner Smith. I am a mental health therapist and sport performance provider for the University of Iowa Athletics Department. My role is to provide mental health and sport performance services to our student athletes in both an individual and team setting. So if you are experiencing anxiety or emotional distress, my suggestion is first and foremost to reach out and ask for help. We unfortunately have a stigma in our society that frames emotional distress as something that we should be able to just get through or get over. And I think we should see it just like physical health, where if you experience sickness or an injury, we go see a doctor to alleviate that pain. And with emotional distress, we see it as something that, again, we should be able to just deal with on our own, where we often compare hardships and we say, well, this person has it worse, so I shouldn't feel a certain way. But we all have different experiences, we all have different ways of coping with things. And so we can't compare how we handle all the stressors in our lives. When it comes to suicidality, my thought is just that it's okay if you're having those thoughts. We know that suicidality often is underlined with thoughts of guilt and shame and internalized judgment. And if we frame it as something that we shouldn't be having or demonize those thoughts, oftentimes it exacerbates that underlying symptom. And we see suicidal thoughts as a symptom of mental health. And if we're experiencing those, it's natural. It's something that our bodies and our minds naturally have a habituation to go away from pain and towards comfort. And so if you're feeling a lot of emotional pain, it's normal for our thoughts to go that direction, and we can't stop those thoughts. And so I just want to frame it as something that is a symptom that can be treated and to not demonize in our minds. So one myth that I see is that it is weak to seek services for emotional distress and anxiety and different ailments in our lives. And so I often think about it as it is courageous to do something that is hard. And because of the stigmas that exist in our society, it is hard to go seek help and see a therapist. So I see, going in for mental health services as a very courageous act. The myth is that we should be able to just control our mental health. And that it is something that should be demonized, or we should be able to just get over things in our lives. But that's just simply not the case, and not the way that we know our brains work. And so one thing we really preach in our department is the self-acceptance and understanding that it's okay to not be okay, and that you have to accept that to take that step in receiving help for the things that you're going through. If you or someone is in crisis or having suicidal thoughts, call the 988 Suicide and Crisis Lifeline. It is free and confidential. And it is not emergency medical or police response, but they will connect you with trained professionals 24/7 for free when you need them the most. There is hope with the 988 Suicide and Crisis Lifeline.